Promita, and so actually from past few days I have been facing some problems in my stomach, and because of that I have consulted many doctors outside Fortis. Then there are some of my relatives, they suggested me to consult you. So today I am here to take some suggestions and some advice from your end. So before, and the doctors outside have suggested me to undergo endoscopy process. So before undergoing that process, I wanted to take some suggestions from you, and I have some queries which I want you to clarify me on that. So the first question that I have is, how much time does this endoscopy process take?
So endoscopy, I tell you, with the new machines that we have, it takes less than 1 minute, I could say, or maximum 1 minute. So the whole procedure, seeing the esophagus, stomach, duodenum, that we could do in less than 1 minute. So the exact procedure is of 1 minute duration.
Okay. And sir, the thing is, once we undergo this process, is there any problem that the patient faces, or is there any pain that happens during this process?
So yeah, actually this is a myth prevailing in our society because the technology 20 years back, what happens is that many of our known to or relatives, they have undergone the test 20 years back with the old machines.
Exactly.
So they had some discomfort, and then once they share, so the patient becomes frightened. But now in the new technology, the newer machines which we have, they are very thin and soft tubes, and with the advanced technology, there is no discomfort, minimal discomfort. And rather at our setup, we believe in the concept of painless endoscopy, in which we will be giving a local spray and some sedation. So rather you will be not aware of the test at all. So it will be a very non-discomfort at any end.
Alright. So sir, after undergoing this process, after how much time will I be able to take normal meals, and how much time does that discomfort prevails?
So just 10 to 15 minutes after the discomfort is in the throat is over of the local anesthesia that we spray, and then you can have liquid. Okay. And after 1 hour I will be able to take a normal meal you can take.
So the throat discomfort or whatever discomfort is there, it goes naturally, or some medication is suggested?
Yeah, it goes on its own. The effect disappears in the 1 hour. So very much normal after 1 hour. Need not take any other medicine for that.
Okay, and the solid food can be taken when, sir?
Yeah, you can take after 1 hour. A normal meal you can take
meal.
after 1 hour.
Okay. So sir, do you suggest any other alternative test other than endoscopy to get the accurate result?
Yeah, actually this is the most frequent question we are facing. Rather, patient is very much after that you should take any other test except endoscopy. But I would like to hear, let you know the fact that any other test, including sonography, CT scan, MRI, if we combine all the three, then even the information that they provide is not in any way competes the information which the endoscopy gives. So it's a beautiful test. In less than 1 minute we have a beautiful details of any pathology. So I think it's a unique test, and it should be undergone any time when we are having any suggestion of luminal symptoms. It should be done.
So according to you, no alternative test can replace this endoscopy process?
Yes, the information endoscopy provides is not contributed by any other test.
Okay. So my last question for today is that what precautions do I need to take before undergoing this process?
Yeah, so I think now we are very much convinced with the safety and the informative use of the endoscopy.
Definitely.
So for this test, you have to have at least 6 hours of fasting from solid food and 4 hours of fasting from liquid food. Okay. So before for example, any stipulated time, so before 4 hours, it is the last liquid you can take, and before 6 hours, it is the last solid food. So at least minimum 4 hour fasting we require so that we can do this test in a better way.
So morning time is the best time, I think, to get this
definitely.
endoscopy process.
Yeah, that is the time we prefer for our patients.
Alright. Thank you so much, sir. Thank you.